Hi everybody! Goddess of Radical Self-Love here from MECA. Make everyone count always. We are a resource network for caregivers, care receivers, and resources within the long-term services and supports industry. So we're starting off today, as usual, with Meditations from Conversations with God by Neil Donald Walsh. Although wait, I did want to have one announcement. I woke up this morning to a wonderful message that in the middle of the night, we had our first Patreon membership. Yay! So in the description below, you will find the Patreon link. And make sure you hit the subscribe and like, comment, and share so that we can spread the word to the rest of the caregivers and care receivers that we are going to change this entire industry together to make it what we all want and deserve. So, thank you very, very much to our very first Patreon member. Okay, let's go on with our reading. A true teacher is not the one with the most knowledge, but one who causes the most others to have knowledge. Well, that is interesting. For today, it's really cool sometimes how our readings line up perfectly with that day's instructions or lessons. And today, we're doing things a little differently because we're going to go through a little bit of the business plan that has a lot of vital information for all our caregivers and care receivers of the world. And remember, we're all caregivers and we're all receivers. So, care receivers. Our positions as caregivers and care receivers change all the time. So, back and forth, we all give care and we all receive care. So, I just have to turn this up a bit. All right. So, itchy nose. Who is talking about me or thinking about me? Who is currently providing aid to chronically ill, disabled, and elderly? Our seniors, or wisdom holders, as I would like to call them, but one out of every 12 low-wage workers is a direct care worker in the United States. So, if you are thinking about having an impact on low-income communities, and particularly women, there's no other workforce, no other set of occupations more important. Stephen Dawson, Strategic Advisor of PHI, Paraprofessional Institute. So, who currently is serving our disabled, chronically ill, and wisdom holders, seniors, elderly? They are our caregivers, our direct support workforce, paid and unpaid, but we are talking about paid at this particular point, approximately in Minnesota alone, but definitely consider this for the rest of the country. The numbers do not lie. They're very similar in every state. Larger populations, more. Either way, we need 1 million more caregivers within the next 2 years. So, my nose is so itchy. Approximately 93,000 home care workers, including personal care aides and home health aides, provide caregiving services for older adults and people with disabilities in Minnesota each day. MECA preferred terminology is direct supports. Work in clients' homes. Others work in small group homes or larger care communities, institutions, and many caregivers are family members. Ding. Others visit 4 or 5 clients in the same day. Others only work with one client all day, and in some cases, aides stay with one client for a long-term basis. Some caregivers also sleep or live in their clients' homes. Depending on the client's needs, caregivers may work together in shifts so that the client always has assistance. They help people on hospices and day service programs and may travel with clients to assist individuals with tasks outside their abilities, such as to go to work and stay engaged in their communities. Unfortunately, these workers are not regulated in an effective manner by government at the county, state, or federal level. Direct support professionals, a group of caregivers called direct support professionals, work with people who have developmental or intellectual disabilities. They generally help create behavior plans and redirection of behaviors, emotional regulation, teach self-care skills such as doing laundry or cooking meals. MECA partners provide a working ladder for both PCAs to become home health aides and for both to become certified as direct supports. MECA assists in grant proposals and paid internships for continuing education through multiple avenues for health science careers, a must for social service providers and future policy makers by partnering with the Minnesota Board of Education. Focusing on our young adults, 16 plus, MECA introduces our newest caregivers to their future as independent business owners as an LLC and or joining MECA-approved partnering agencies. The LLC, which I had introduced yesterday, was through one of the other industry partners that we want to join, Linx. MECA also seeks as many new certified direct supports from as many different cultures as possible. Long-term services and supports is required from every demographic, aging, disease, and diagnosis, spare none. We need to be culturally prepared today. Being culturally prepared within the long-term services and supports industry is our obligation as a nation and world. MECA is prepared to hold all systems accountable and support all those who make everyone count always. So caregivers typically do the following: assist clients in their daily personal tasks, such as bathing, dressing, or eating. Housekeeping, such as laundry, washing dishes, and vacuuming. General mobility, observation and redirection of behaviors. Help to organize a client's schedule and plan appointments. Arrange transportation to doctor's appointments, work, school, or other outings. Shop for groceries and prepare meals to meet a client's dietary specifications. Cook and prepare meals. Keep clients engaged in their social networks and communities. And some caregivers may provide basic health-related services or are given specialized training for advanced medical equipment depending on the state they work in. MECA really would like to have a lot of these identified tasks arranged in a way where there's, such as meal prep, that can be delivered. We don't need to have people cooking. Maybe warming up a meal is one thing, but some of these can definitely be coded in a way where we have compassion care, friendship, support as volunteering, and hands-on tasks by a PCA or a direct support specialist. Some caregivers may provide basic health. Oh, I already said that. Sorry. If a disabled individual is under 18, their family or legal guardians are responsible for any care or teaching aids or how to care for their child. These family members or legal guardians generally do not have any medical training themselves prior to the child's diagnosis, which is exactly how I got involved in caregiving. And it was such a big task, and there was so much work involved and so much medical terminology and support needed that I really did feel I had to go to school to understand. So bringing that education home through apps is really where our focus is, especially the psychological part of it, since 70% of the care that goes to a client is from a direct support worker. Not your doctor, not your nurse, direct support worker. So yeah, if a therapist who only sees you 1 hour a day needs to actually have therapy themselves to deal with it, or needs to understand transference or attachment disorder, things like that, you know, it's definitely something that we need to focus more on with our direct support staff. Something that a lot of people are not. The skills can be taught. Everybody can learn the skills. The psychology involved is a much more in-depth focus that we want to highlight. So that's why I'm here. To become a certified home health or hospice agency and receive payments from government programs, agencies must comply with regulations regarding AIDS employment. Locally in Minnesota, they must be enrolled as Minnesota Healthcare Programs providers, but are not required to have a state license. Everything's changing right now too, but still, again, not to the point where we need it. Regulations, specifications have more to do with administration work than actual participant care and supporting those whom provide the care with livable wages and benefits. Creating a present time, long-term services and supports crisis. In consideration of waivers initially created to waive quality control measures, ensuring where and to whom providing services is determined by the waiver holder. Waiver intention allows for paid personal care, direct support, and other forms of services and supports which are not covered under Medicare or Medicaid. Waivers are intended to enable participants the ability to utilize their funds in a way which allows freedom of choice in services and supports and accommodations per the needs required, which provide daily living ability by supporting adequate resources of the participants' choosing. However, as the demand for direct support increases at an alarming rate, steadily, it has for decades, the push for higher wages, a standard of care, and adequate training cannot be pushed through government dogma fast enough. We did just have a hike in pay in Minnesota to $15 an hour in Minneapolis and St. Paul, which is great. However, there is a problem. If the waivers don't go up enough to support that increase, home care agencies are going to pull out of those counties, and long-term care facilities, if they can't pay their workers that much, then they will just hire less workers. So MECA's here to kind of combat that with our requirements of our own. So this is where we're saying forming the group, the membership group. Numbers are power. Can we make those higher requirements that we deserve? And yeah, there's a lot of choices involved when you're dealing with a grant like consumer support driven, right? Except for a lot of the resources that are available, and sometimes the only ones, are not working. So let me give you a for instance. If you are disabled, physically disabled, and you need to learn how to drive, there is one place, the Courage Kenny, the Courage Center, as most people know it, to learn. This doesn't work. We need more, for one. Two, the individual teaching you to drive as somebody who is disabled is not disabled themselves. Okay. I realize there's an education. I get it. We all can get an education in whatever we want. But unless you have extreme personal experience, okay? And I don't even know if you have a child, because I have a child, adult child with disability. She's 21. I should be able to teach her how to drive if I went to school for it, right? I mean, I guess you get taught maybe all the different accommodations, maybe how to use them, but getting taught out of a book compared to having somebody teach you who utilizes those accommodations each and every day makes a little more sense to me. So why would we not have individuals who are disabled teaching my daughter, my adult daughter, right, the conscious queen, how to drive? And let's go one step further. One thing that is missing from a lot of these resources, not all of them, I would say 10%, is communication skills, empathy, compassion. And it's funny because, you know, I am the goddess of radical self-love. So it's not that I don't have love for others. I do. But because I've had to deal in this system for 21 years with my daughter, fighting for what we need, being very disappointed a lot of times, and continuing to see her jump over these needless hurdles that are constantly placed in her way. Constantly. To prove her disability. She is on Social Security disability and she's 21. Let me give you one more. She had surgery in January. We know this, okay? I'll go more into details about that later on a different video. But we ordered, which we knew she was going to need, a wheelchair. She's needed a scooter, okay, wheelchair scooter. We knew she wanted a scooter, so for school it would be more relaxed than a full force wheelchair, because she's had both. We we ordered the scooter. I think pretty sure it's in October. She says early November, whatever. Doesn't really matter. So we knew her surgery is what? January, right? Like the first part of January, second week, I think. We did not know she was not going to be fully non-weight bearing. Okay, we didn't know. We also ordered a walker. Yep. So a wheelchair and a walker. Neither of them were ordered or ready by the time she had surgery in January. She had no wheelchair to go home with when we left the hospital, the nursing home that she was in for just a few days because I had to break her out because it was such incompetent care. So we're in November 20th. This is still an entire year later. We still don't have the wheelchair. No wheelchair, no scooter. I bought one from a drugstore or whatever, just a push one that had little tiny wheels on it and was not, you could not use that as a normal wheelchair. It's not even rated for that. It's just to get from like this room to the next. Not, you can't go on a walk. You can't take it in the mall. You're not supposed to anyway. So when you want to talk about the resources, like I want to talk about the resources, there is a reason why I'm worried about all these people who are turning 65. 10,000 people a day are turning 65. Okay. 70% of them will need long-term services and supports. Very, like, within their lifetime. Okay. 70%. That number gets higher as they age. So I'm scared to death. Because you all, whoever is watching this, if you're over 65, you should be getting worried. If you're even 50, you should be getting worried. But I guess not as much 50 because now MECA's here. You know, we can do some things right now, like in the next 10 years. We can change this. And that's what we want to do. We want to make sure you and your family members do not have to go through all these resources to find out, well, that they're shit. We want to know the good resources. And I do have a lot of great resources. I mean, we had to go through a lot of bad ones to find a lot of good ones. But you don't have to. And those of you who know the good resources, we need to share those resources with everyone so that we can save a lot of people from abuse, neglect, maltreatment, financial abuse. I mean, the list goes on and on about the different circumstances that everyone is facing within this industry that have no clue who are about to enter it. It's like going into a big, deep, dark hole. One that I went down, I fell down. But it's okay. I learned a lot. I learned a lot for all of you. The Conscious Queen, she's learned a lot. We're both here to help. We got a lot of people who will be helping. So that was your education for today. Oh, it's all happening. And we're starting with the caregiver crates. So we can support those who need it most, the caregivers at home and who are working in a lot of these facilities or who are direct care workers. And as we find resources that do work, they will go up on our resource grid. I just talked to a really great one today, and they're super excited about it. So, yeah. So let's move on to deprogramming. A Course in Miracles, I like to call deprogramming. Yesterday's lesson was I see only the past. And yes, you know what I noticed from I see only the past lesson was how many things around me are brand new. And I'm not looking at those things. It was actually pretty incredible when I was even just sitting here looking out my front window and realizing how many things around me are brand new. And then I even started looking around in my home and realizing where my eyes go towards or where my mind goes towards is constantly to the past. It was so moving on from yesterday's lesson 7. Lesson 8. My mind is preoccupied with past thoughts. What did I just say? I mean, I should have just wrote this. Just kidding. I'm just kidding. My mind is preoccupied with past thoughts. I mean, that is pretty amazing. Yeah, I'm right there with them. It's really difficult when the past thoughts keep coming back, like things from the past keep coming to you, so you have to go back there and have the past thoughts. It's like a vicious circle. How do you just cut it off? Let's find out if they tell us. My mind is preoccupied with past thoughts. This idea is, of course, the reason why you see only the past. No one really sees anything. He sees only his thoughts projected outward. The mind preoccupation with the past is the cause of the misconception about time from which your seeing suffers. Your mind cannot grasp the present, which is the only time there is. It therefore cannot understand time and cannot in fact understand anything. The only wholly true thought one can hold about the past is that it is not here. To think about it all is therefore to think about illusions. Very few have realized what is actually entailed in picturing the past or in anticipating the future. The mind is actually blank when it does this because it is not really thinking about anything. The purpose of the exercises for today is to begin to train your mind to recognize when it is not really thinking at all. While thoughtless ideas preoccupy your mind, the truth is blocked. Recognizing that your mind has been merely blank rather than believing that it is filled with real ideas is the first step to opening the way to vision. The exercises for today should be done with eyes closed. This is because you actually cannot see anything, and it is easier to recognize that no matter how vividly you may picture a thought, you are not seeing anything. With as little investment as possible, search your mind for the usual minute or so, merely noting the thoughts you find there. Name each one by the central figure or theme it contains, and pass on to the next Introduce the practice period by saying, I seem to be thinking about blank. Then name each of your thoughts specifically. For example, I seem to be thinking about name of a person, about name of an object, about name of an emotion, and so on, concluding at the end of the mind searching period with, but my mind is preoccupied with past thoughts. This can be done 4 or 5 times a day during the day unless you find it irritates you. If you find it trying, 3 or 4 times is sufficient. You might find it helpful, however, to include your irritation or any emotion that the idea for today may introduce in the mind searching for itself. My mind is preoccupied with past thoughts. So I seem to be thinking about my work that I love. I do. I love it. Oh, caregivers, here's your caregiver cheer. Caregivers, care receivers. Wow. Look at all you have made it through. Look at all you guys have accomplished by even having broken resources. You guys have pushed your ways through and made it and made some amazing changes to people's lives, even without the support you all needed and deserved. You know, you guys are definitely rock stars. You all should be getting some stars on Hollywood. Ooh, that would be so fun. We could do that with our members. Yeah, I think that would be pretty amazing. One day when MECA has building, we're going to put member stars up, which are you guys. Thank you so much for educating yourself on the illness or diseases or just, you know, our regular bodies breaking down or our mind breaking down from old age or from stress or from disease, chronic illness. Thank you for doing the homework even when nobody was pushing for it. Thank you for getting your CPR certification and your first aid certification. Thank you for taking the time to understand what your care receivers are going through, whether they're children or adults or old age. Thank you for understanding that they needed you to be educated. Thank you for constantly searching for resources for them and for yourselves. Thank you for continuing to. Thank you for reaching out to everybody in your community as much as you could to get the support you deserve. Thank you for learning government-funded programs. Thank you for learning to communicate effectively in order for our care receivers to get the care they need. Thank you for working with schools and educating our teachers. Thank you for understanding educational platforms with IEPs and care plans. And thank you, family members, for always going back to our institutionalized care to visit with your family members, especially on a day like Thanksgiving or the holidays in general coming up. Thank you for understanding that they still need and deserve your love and attention and affection, even if they don't even remember who you are within their mind. They do within their heart. We thank you. Please comment, like, and share, and subscribe. Donate. go to our website, go to our Patreon, and we will see you on Friday. Love you all.